Please introduce yourself and what you practice.
Hi, I'm Dr. Vrushali Gersappe. I'm a psychiatrist and a sleep specialist working out of Swedish Redmond. And yes, I'm here to help you girls out with your high school project.
When you see patients with PCOS, what kind of sleep problems do they usually have?
So I see patients who have PCOS who are struggling with sleep problems such as insomnia. And most of the times it's always sleep apnea. And then the third thing I've seen with patients with PCOS are they struggle with a lot of daytime fatigue and sleepiness. So what you have to understand is sleep is not just the night time that we spend time asleep, but it's also the daytime functioning of wakefulness. That is the whole spectrum of sleep. So when somebody comes to us saying that they are very tired, it's very important for us to look into other medical reasons why they are tired. And often people with insulin resistance have a lot of tiredness and sleepiness. So yes, do you have any more questions? Otherwise, I can talk about overview of sleep and PCOS.
Go ahead.
Yeah.
Yeah, you go ahead first, and then we can ask the rest.
So do I continue?
Yeah.
Okay. So often we see like PCOS has like three parts to it, which are related to the symptoms of PCOS. One of them is obesity. PCOS leads to a lot of weight gain, and it causes insulin resistance. And what we see with the weight gain is increase in BMI, which leads to sleep apnea. Ria, can you share the diagram of the sleep apnea?
Yeah.
So if you look at sleep apnea, can you see my cursor?
No.
No, it's okay. So if you see the blue line in the first diagram, the blue line indicates the air entering through the nose and into the back of the throat and into the lungs, where the oxygen exchange occurs. But if you look at the second picture, which marks as the blocked airway, the tongue rolls back and completely eliminates the throat opening. As a result, there's no air reaching in your lungs. So the definition of sleep apnea is how many times in your sleep do you stop breathing per hour? So if sleep apnea remains undiagnosed or untreated, there are chances of someone landing up with a stroke or a heart problem. Now, sleep apnea occurs in people who have increased weight. So if PCOS leads to increased weight, those people are likely to come into my clinic for getting treated for sleep apnea. And then sleep apnea also needs to be treated so that the patient is able to sleep through the night and to reduce the stress hormone cortisol on their body, which actually makes PCOS worse. So treatment of PCOS becomes very important in the first place so that the patient does not gain weight. If they have weight problems, then they needed to be treated for sleep apnea, and they have to work on weight loss. And then the second problem is sleep apnea also, there are higher chances of males getting sleep apnea. And what happens in PCOS is there is a release of androgens, which causes the body mass index, like the muscles, to become more masculinized because our viralization occurs because of the androgen, leading for PCOS patients to having higher risk of developing sleep apnea. Does that make sense? And then the insulin resistance leaves patients feeling sleepy during the daytime. Therefore, it becomes very important that we screen people for PCOS so they not only get treated for their sleep problems, but they have to start addressing the signs and symptoms of PCOS with their GYN or their primary care doctor as well.
Excuse me. Sorry. Resume. Okay, we're back.
Yes. So this pretty much explains the cycle of sleep apnea. The sleep disorders in PCOS with women with obesity, altered hormone profile, depression and anxiety, poor lifestyle, they tend to like have diabetes, weight gain, heart problems, and this in turn creates a cyclical thing with sleep apnea and sleep disorders becoming worse. So treatment includes for sleep apnea, especially CPAP therapy and weight loss. And then they have to work with their GYNs to get on a birth control or metformin to get their metabolic syndrome and PCOS under control. So these are the treatment options for PCOS and sleep problems.
Great. Thank you so much.
Thank you.
You're welcome, and all the best in spreading awareness for PCOS.